Hello, 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 it's Medicosis Perfectionalis, where medicine makes perfect sense. Let's resume our biology playlist. In the previous videos, we talked about the heart, the vessels, the blood cells. Today, it's time to talk about blood pressure, specifically the arterial blood pressure, which is the pressure inside your arteries. Now, I'm not talking about your pulmonary arteries. I'm talking about your systemic arteries that branch off of the aorta. When I say that your blood pressure is 120/80 millimeters of mercury, this is not a mathematical ratio because some crazy students will do like this. Let's cancel the 0 with the 0, okay? And then 12 divided by 4 is 3 over 8 divided by 4 is 2. So 3 over 2 is 1.5. Yeah, doctor, the patient's blood pressure is 1.5. What the flip are you doing? This is not a mathematical ratio. This just means that your systolic blood pressure is 120 millimeters of mercury and your diastolic blood pressure is 80 millimeters of mercury. Where did you measure them? In big arteries during systole versus during diastole. With that said, now let's get started. This is my biology playlist. Please watch these videos in order for maximal understanding. Let's review the cardiac cycle, which was discussed before. We start here at the left ventricle. What do we have? Oxygenated blood. Left ventricle into the aorta through the aortic valve. And then we are here at the aorta, oxygenated that is. And then the aorta is going to pump us all over the body, upstairs, downstairs, everywhere. And then after the aorta, you have arteries, and then arterioles, and then you have capillaries. There is an arterial side, and there is a venous side. Where is the freaking cell? My freaking cell is here. Here is a cell, here is a cell. What are they doing? Waiting. Waiting for what? For oxygen from the artery. They will take that oxygen from the artery. They will use that oxygen for metabolism, and then they will dump their CO2 onto the vein. And then you start here. What are these? Venules, and then veins, and then big veins, until you end up with the biggest two veins, inferior vena cava and superior vena cava, from the lower half of the body and the upper half of the body, roughly speaking. And then we end up here in the right atrium. We are deoxygenated blood. The deoxygenated blood will be pumped from the right atrium to the right ventricle via the tricuspid valve. And then the deoxygenated blood is now in the right ventricle. Right ventricle will push it, systole. Before you know it, the blood will enter the pulmonary artery via the pulmonic valve. Deoxygenated blood is in the pulmonary artery. Boom, boom, we are in the lung. The lung will take the carbon dioxide, gas exchange, will give you oxygen. Now you're oxygenated and you'll go back to the left atrium via pulmonary veins. Oxygenated blood will enter the left atrium. The left atrium will push it, the atrial kick, to the left ventricle via the mitral valve, which has only two cusps. This is the only valve in the heart with two cusps. The other three have three cusps each. Hi Medicosis, this lecture is about blood pressure, arterial blood pressure. What are you measuring? I'm measuring the pressure in the big arteries that come off the aorta. Example is the brachial artery in your arm. That's why the doctor will wrap the blood pressure cuff around your arm. Anatomically speaking, you have one heart. Physiologically speaking, you have two hearts. There is the left side, which is responsible for giving blood to the systemic circulation, and you have the right heart, which is responsible for pumping blood to the pulmonary circulation. Today, we are concerned with the systemic circulation. That's why we care more about the left ventricle in today's lecture. Arterial blood pressure is the pressure in big arteries, and you need two numbers, during systole and during diastole. The first number during systole. Whose systole? The left ventricle systole, which actually happens at the same time as the right ventricular systole. Okay, so you mean when my ventricles are pumping, that's systole. True. And when this happens, the doctor is going to measure your blood pressure in the big arteries, like your brachial artery. And this number is called systolic blood pressure. Let's say that your systolic blood pressure is 120 millimeters of mercury. Okay, now what's the second number? The pressure in big arteries during diastole. Whose diastole? The ventricle's diastole. Oh, okay. And the doctor is going to measure the blood pressure during this moment, and let's say it is 80. Therefore, your blood pressure is 120/80 millimeters of mercury. millimeters of mercury for systolic, millimeters of mercury for diastolic. This is the measuring unit for blood pressure. Systolic blood pressure over diastolic blood pressure. The measuring unit is millimeters of mercury. In a previous video, we talked about the pressure in the 4 chambers. This is the pressure during systole when each one is contracting. When the right atrium is contracting, the pressure is about 5 millimeters of mercury. How about when the left atrium is contracting? 10 millimeters of mercury. Right ventricle, 25. And the left ventricle is 120. Basically, this is your good old fiat currency. You have the nickel, the dime, the quota, and the dollar. The dollar here is the systolic pressure in the ventricle, which is 120. So now you know the systolic number. You know 5, 10, 25, 120. All of this happens when each chamber is contracting. When each chamber is relaxing, everything in the heart is 0. And that's the pressure in the 4 chambers. Hey, medicosis, is this today's topic? No, today's topic is the pressure in the arteries, not in the chambers of the heart. Big difference. And that's why the pressure in the left ventricle, for example, is 120 systolic. Over what? Over 0 diastolic. But the blood pressure in big arteries is what? 120. Oh, okay, that's the same number as this. Yes, but notice the difference. Diastolic is how much? 80. Oh, but hey, wait a second, medicosis. I get the 120. The source of the 120 is the contraction of the left ventricle. Awesome. Who the flip came with the 80? And the answer is the vessels, by their sheer volitional force. What do you mean? I mean vasoconstriction. They decided to vasoconstrict. Why did they do this? Because if they didn't vasoconstrict around that blood, your pressure would fall to 0 during diastole. You know what's going to happen? You're dead because your brain is not going to eat. Your brain is not going to be supplied with blood. More importantly, the coronary arteries, the arteries that supply the heart, fail during diastole. If your pressure is 0 during diastole, the heart is not going to eat. Oh, no heart, no brain, no kidneys. You are what's known as toast. You are 6 feet under. The aorta and the big arteries decided to clamp down and to constrict around that blood during diastole so that the pressure in the arteries during diastole does not fall to 0 like what the ventricle did. Instead, it should be maintained at about 80 to maintain perfusion of vital organs such as brain, heart, kidneys, etc. And that's why your doctor will tell you that your pressure was 120 over 80. What's the 120? It's the pressure here. Yup. What's that? That's the pressure in big arteries during systole. Who's the source of this? Left ventricle contraction. How about 80? It's the diastolic blood pressure. What does that mean? It's the pressure in big arteries during diastole. When the ventricle is relaxing, the pressure in the ventricle is 0. We don't care about this, but the pressure in the big arteries is 80. What's the cause? The contraction and the constriction of big arteries, and they're clamping down on the blood inside them. Bring a piece of paper and write the definitions. You have to do this. What's the systolic blood pressure? It is the pressure of blood. Where? In big arteries. When? During systole. Ventricular systole, that is. And it's normally around 120. 120 what? Millimeters of mercury. Thank you, Captain Obvious. How about diastolic blood pressure? It is the pressure of blood. Where? In big arteries. When? During diastole. Ventricular relaxation, that is. And normally, it's around 80 millimeters of mercury. Unlike the ventricle, whose diastolic pressure was 0. What's the name of the device that has the blood pressure cuff that is found at the doctor's office? It's called Sphygmomanometer. What the flip is that? It's basically a manometer modified to measure blood pressure. Do you remember the manometer in physics? Oh my goodness, shut up, it's easy. You equalize the 2 parts, okay. There is mercury, okay. We know the height of the mercury. If you know the height of the mercury, you can equalize the pressure here. And just by knowing the height of the mercury, you can establish the height of your blood. And then, with these equations, you can find the blood pressure. If you have normal blood pressure, congratulations, you are normotensive. Okay, normal arterial blood pressure. This is your systemic circulation, of course. What is hypertension? You have high blood pressure. We're referring to the pressure in big arteries in the systemic circulation, like the brachial artery, the radial artery, the ulnar artery, the popliteal artery, etc. Not the pulmonary artery, and of course not in the heart. What is hypotension? The opposite. You have low systemic arterial blood pressure. Remember last time you were holding a hose? Yes. And the water was rushing in? Yes. And you felt pressure against your hand? Yeah, what was that? That was the water pressure against your hand. Same exact concept applies for blood. The blood, while moving inside the vessel, exerts a pressure, which is nothing but a force applied on a surface area. Oh, I get it. What happens if you decrease the area? What do you mean? Vasoconstriction. If the artery got narrower, the area will decrease and the pressure will go up. So if you constricted your vessels, their radius will decrease. Okay, their diameter will decrease, of course. Resistance goes up. Blood pressure goes up. You know why? Because resistance and radius are inversely related. The small r is the radius. The big R is the resistance. When I vasoconstrict, radius goes down. Okay, resistance goes up. And when resistance goes up, blood pressure goes up. You know why? Because blood pressure equals cardiac output, which we have discussed before, times the total peripheral resistance. Oh, so between the resistance and the blood pressure, there is a direct correlation. When resistance goes up, blood pressure goes up. Let me give you an example. Norepinephrine. Norepinephrine can raise your blood pressure. You know how? It constricts your arteries. Oh, when you constrict my arteries, radius will decrease. Resistance in the arteries will increase. Blood pressure will go up. How do doctors treat high blood pressure? By giving you vasodilators. Why? To increase the radius, because I'm dilating the vessel. The vessel is getting wider. When the radius goes up, resistance goes down. When resistance goes down, what's going to happen to blood pressure? It's going to decrease. Oh, that's cool. What's the cardiac output? It's the volume of the blood that comes out of your heart in 1 minute. It's the output of the heart. How good is it? When I give you an input, do you give me a good output? Yeah, I give you a good output per minute. And of course, this depends on how fast and how strong the heart is pumping per minute. Heart rate times stroke volume equals cardiac output. Let's just assume some numbers to make it easy. 50 ml is the stroke volume. What does that mean? Each time the heart pumps, it ejects 50 mLs of blood. Okay, and how many times do you do this pump in every minute? I do it like 100 times. 50 times 100 equals 5,000. 5,000 what? ml per minute. Easy, because the heart rate is beats per minute. Stroke volume is ml per beat. The beat is going to cancel the beat, and you will be left with ml in the numerator, minute in the denominator. So your cardiac output is basically 5 liters every minute. That's how good your heart is. What if I have heart failure? You will have decreased cardiac output. And this is the most important equation. If you go to your exam without knowing this, there is no hope for you. I'm just joking. But not really, because this is really important. The mean systemic arterial blood pressure. Mean here doesn't mean cruel. It means average. The average arterial blood pressure. What kind of artery? Pulmonary? Shut up. Systemic arteries is dependent on two things. The cardiac output multiplied by the total peripheral resistance. And as you know from the previous slide, the cardiac output is made of two things. What are they? Heart rate multiplied by stroke volume. Thank you. Hey medicosis, if blood pressure is cardiac output times total peripheral resistance, and since cardiac output is heart rate times stroke volume, can I play with some algebra and write it like this? Sure. Back to basics. When I say systole, it means contraction. It could be contraction of the atrium or contraction of the ventricle. Since we care more about the ventricles because it's bigger and more important, basically when we say that the heart is in systole, we mean that the ventricle is in systole. When we say systolic blood pressure, we mean the pressure in big arteries when the ventricle is in systole, when the ventricle is contracting. Same concept applies to relaxation or diastole. Get another piece of paper and write the definitions, please. The cardiac cycle was discussed before. Please pause and review. You have to know everything here. Get a third piece of paper and write all of this. The systolic blood pressure depends on many things. The most important of them is your ability of your heart to contract. The stronger the contraction, the higher the systolic pressure. Okay, how about the diastolic blood pressure? It depends on many factors. How good your vessels are, for example. Why? Because remember, who is responsible for the 80 or the diastolic pressure? Oh, the clamping down, the constriction of arteries around the blood. Sure. So if you have healthy arteries, you'll have good diastolic. If you have arteries that have been damaged from atherosclerosis or hardening of the arteries, you'll have a bizarre diastolic blood pressure. Okay. So it really depends on the elasticity of your arteries. It also depends on the total peripheral resistance, which depends on the radius of the arteries. Oh, that makes sense. These are the most important equations in cardiology. If you are a medical student, of course you have to know every single one of them, or I'll smack your gluteus maximus, metaphorically speaking. But if you are studying biology, just getting started, memorize this one and this one at the very least. When you master these two, add the total resistance. If we have 3 individual resistances and they are connected in series versus in parallel. Remember, everything here is inverse. A very common mistake among students is that they will remember this, right? Oh, they are connected in parallel. For example, this is your brain, this is your kidneys, this is your uterus. That's some parallel connection right there. The students will remember this part. And then the answer, and then for example, they will add these together. And 1 over R1 plus 1 over R2 plus 1 over R3. Let's say, just suppose that this happened to equal 4. Students will say, oh, the total resistance is 4. No. 1 over the total resistance is 4. Because when you added all of these doofuses together, you got 4. Now, 4 is not the resistance. 4 is 1 over the total resistance. Therefore, in this case, RT will happen to be 1 over 4. The answer is 1 over 4 and not 4. Very, very, very common mistake among students. So just remember, it's not the 4, it's 1 over 4. Be very careful. What's the mechanism of hypertension? I did not say the cause of hypertension, I said the mechanism. Okay, since the mean systemic arterial blood pressure equals cardiac output times total peripheral resistance, and since cardiac output is heart rate times stroke volume, and since the stroke volume is dependent on how strong the heart is contracting and how much blood did I receive. Of course, I want to contract and push blood. You have to give me some blood in order for me to push, right? Yeah. Therefore, can I get high blood pressure because my heart is pumping really fast? Increase heart rate? Sure, it's possible. Can I get hypertension because my heart is contracting very strongly? Yeah. Can I get it because I have too much volume in my circulation? For example, my doofus doctor injected me with lots of fluids. Oh, for sure this will raise your blood pressure. Can I get hypertension because my total peripheral resistance went up, which means that the radius of the vessel is getting narrower? Sure. Why do you think your grandpa has hypertension? His vessels are narrower because of hardening, because of atherosclerosis or other conditions. Easy peasy, lemon squeezy, medicosis schmeezy. Since your blood pressure is very vital, how does your body regulate it? How does your body respond to it? Does your brain have a say about your blood pressure? Of course it does. And we talked about the baroreceptor reflexes in my physiology playlist, specifically in the autonomic nervous system section. Hey medicosis, what is the afterload? Well, the afterload, just remember the arteries, okay? From the perspective of your lovely left ventricle, this left ventricle has to pump against the resistance, okay? Resistance is where? Well, I have to pump against the aorta and the arteries. Oh, so I have to pump against arteries. That's the afterload. It comes after the contraction. Oh, I get it. Then what is preload then? Preload is the blood that goes to the heart. For example, the venous return from the superior vena cava and the inferior vena cava back into the right atrium. That will be the preload of the right ventricle because it's coming to the right ventricle. What's the preload to the left ventricle? Well, the blood that's coming to the left atrium from the pulmonary veins, and then it's going to leave the left atrium and go to the left ventricle. That's the preload, which comes before the left ventricle. And then after the left ventricle contracts, I encountered the resistance in the arteries, which is called the afterload. Decreasing the afterload is one way doctors can manage your hypertension. They can give you medications that vasodilate. When you dilate, the radius goes up, resistance goes down, afterload decreases, diastolic blood pressure decreases, blood pressure decreases, and your heart is smiling because it's easier for it to pump against a lower resistance, against a lower afterload. That was beautiful. Do you remember my previous equations? Sure. Blood pressure was dependent on the cardiac output, which had heart rate and stroke volume. The stroke volume was dependent on the strength of the heart muscle, the force of contractility, and how much blood is in it. Oh, I get it. Therefore, how can doctors manage your blood pressure? They can decrease the cardiac output. And how is this? They either decrease your heart rate or decrease your stroke volume. How do you decrease my heart rate? Give me something like a beta blocker. It's a class of medication that lowers your heart rate. It tells your heart, hey, slowly, take it easy. Beta blockers talk to and inhibit your SA node. Okay, what else? Beta blockers can also lower your stroke volume. Hey heart, take it nice and easy. The stroke volume depends on the force of contraction. It also depends on the blood volume. Doctors can decrease the volume of fluids in the circulation. How? By giving you diuretics. Oh, these are medications that lower your blood volume. Less volume in your circulation, less venous return, which is the input or the preload to the heart. Less input, less output. One last technique is to decrease the total peripheral resistance or decrease your afterload. How? By dilating your arteries. If I give you a vasodilator, your vessels will dilate. No kidding. Radius goes up, resistance goes down, pressure goes down. Mission accomplished. Today's video was so epic, but it does not hold a candle to my renal physiology course, which you can download today at medicosisperfectionis.com. I also have a cardiac pharmacology course with 50 videos and notes and cases, of course. Go to medicosisperfectionis.com. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my premium courses. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.